Welcome to Pharmacology Lectures. We are going to have a look at direct acting cholinergic agonists. Those which act directly and are cholinergic agonists, they will copy the same actions. When acetylcholine binds to cholinereceptors that are muscarinic or nicotinic, these agents are broadly classified into two, which are directly acting. There are two types: cholineesters or naturally occurring alkaloids. Cholineesters are acetylcholine, synthetic esters of choline such as carbachol, bithanicol, and the other naturally occurring are nicotine and pilocarpine. All direct acting will have longer duration of action, and these two basically for the first one it is bithanicol, the important drug, and the second it is pilocarpine, which we have to study and remember it. Okay, preferentially bind to the muscarinic receptors and are sometimes known as muscarinic agents. Okay, you can have a look at the structure. It is very important to see the structure. It usually comes in your licensing exams. Acetylcholine first. There is a chain, there is an amine group, okay, and there is also bond cleaved by acetyl. Okay, usually here acetylcholinesterase works and it separates them both. Now, what is the difference between acetylcholine and bithanicol? The bithanicol is a derivative. What happens? Only one methyl group has been added here in this C carbon, and one amine group has been added instead of methyl group. For acetylcholine, there is no branching over this C and methyl group is present, and for bithanicol there is a branching over this carbon and an amine group is present at the end. Now, for carbachol, there is no branching, but an amine group is present here. Pilocarpine is a natural product, and you can see here there are two rings for pilocarpine. Ethyl group and methyl groups are here. Now, first we are going to study deep about acetylcholine. Now, acetylcholine is a quaternary ammonium. Okay, we have seen it has an ammonia compound, quaternary. It has 4 carbons that cannot penetrate the membranes because it is a large structure. Now, what actions does it show? Decrease in the heart rate, decrease in the blood pressure, and other actions we will see. Now, how it decreases the cardiac output. Acetylcholine decreases cardiac rate, that is bradycardia, and cardiac output because reduction in the rate of firing of SA node. Decrease in BP. Acetylcholine will activate M3. We have seen previously M3 receptors found on the endothelial cells lining. Or for heart, there was M3 receptor of the smooth muscles of blood vessels. This will result in the production of nitric oxide and arginine. Nitric oxide will then diffuse into the muscle cells and it will stimulate protein production, and then hyperpolarization will occur, smooth muscle relaxation will occur. So, as in the absence of cholinergic agents, the vascular receptors have no known function because acetylcholine is never released into the blood in significant quantities. Atropine, it blocks these muscarinic receptors and prevent acetylcholine from producing vasodilation. Other actions: GI tract, acetylcholine increases salivary secretion, gastric acid secretion, and it also stimulates intestinal secretions and motility. It will increase the secretions. It also enhances bronchial secretions and causes bronchoconstriction in the lungs, constriction. In GUT, it causes urination by increasing the tone of the detractor muscle. In the eye, acetylcholine is involved in stimulation of the ciliary muscle and causing meiosis, constriction of the pupil. So we have seen decrease in BP, increased secretions, increased urination, pupil constriction for acetylcholine.